So your 70 born means you're 51, है ना? So you're 51 years old. So now, see, the thing, the way it, the pathology or whatever the things your body is showing from last few months, okay? Just imagine like 3 to 4 months or 5 months of history she is giving, okay? So in that, in between, what happened is like you took the vaccination, but before that you already had the mouth ulcers, and you already had the dryness of cough and salivary gland infection, the swelling, the challenges in this area. So the thing, the way Ayurveda sees it, okay, that means there was some kind of heat or there was some kind of imbalance in your pitta already in your body. Not only the pitta, also you had a dry cough, dry coughing, right? So there was something with the vata as well, pitta as well as vata. Vata samajh mein aata hai? The vata is a kind of the energy which brings all the movements in the body. Pitta is the energy which brings all the changes in the body, and kapha is the energy which brings all the collections, collectiveness, or the cohesion in the body, putting stuff together.
I'm gonna stand for a little.
Sure, sure. If it is hurting, stand. You want to sit on the sofa?
No, I just keep.
Are you sure?
कभी बैठना उठना
कोई
बस
बात नहीं,
वही।
कोई बात नहीं. So the thing is like the way it is happening in your body is like you need to understand what you are offering to the body and how that is also impacting on your certain things which unknowingly is getting out of the balance, out of the harmony, and that's where even you have such a beautiful way of living, right? You do certain things on the certain time, you don't eat after 7 or 6 p.m, and then you have good rituals for yourself, right? But still the things, what content, what is coming through your food is also something which is provoking the pitta dosha in the body. So you have like a kind of, just imagine like this. Don't go too much into the words. I'm just giving you the analogy. Just try to understand the analogy behind it. So you see, when you're filling out the paper and everything, you said, oh, I forgot to tell you the mouth ulcers. I forgot to tell you this. So this was one of the major thing before even it happened in your body. So the very important thing. First came mouth ulcers. Second came the dryness. The third came the infections in this area. But you had a huge history of fibroids, which is 5-7 years of history, 5 to 6 years of history of fibroids. Now look how we are going towards the vata dosha. Understand the Ayurvedic way of pathology or Ayurvedic way of looking at the things what you are suffering. So you have a history of fibroids. So fibroid is connected with which organ in the body? Again, the female organ, the uterus, right? But this uterus is located where? All the way bottom part of our body. And that bottom part is dominated by which dosha? Vata dosha. Gases आते हैं ना, बाहर निकलते हैं, वहीं से सब निकलता है ना, cramps आती है, spasm आता है. So whatever we have in that area, it is dominated by the vata dosha. So like the way you have history long time back with the vata dosha, which over the period of time you already have the fibroids, right? Along with clotting in between when you had a cycles. Now you are towards almost like a menopause. So again the age is dominated by vata. है ना? Time बोलते हैं उसको. Like काल. So the body's vata is already naturally there. But through the food and through the things, whatever you did, already the pitta is too much imbalanced in you. That's why you are getting ulcers. That was the first indication for you. But on top of it, in between, after that ulcers and all of that, you took that vaccination, right? So maybe something triggered in your body with that kind of thing. Maybe you went to emergency first. Otherwise, if you have gone to the primary care, he might have told you that, hey, you have shingles. But as you went to the emergency first, they have to do whatever the problem you had, a pain. in the body, or the heaviness in your legs, sciatica pain, inflammation, burning sensation, tremendous burning in your skin, that kind of all of the things, you went to the emergency to get some relief because you were suffering with that, right? After that, you went to your urgent care, then you went to your primary care, and your primary care guided you that you have this and this and this. The very important thing, the way Ayurveda sees this thing in the body, is like you need to understand which doshas and which doshas are aggravated in you, and what are the reasons of aggravation of these doshas, and what are the things you can do. Now there is even if you have a sciatica, the sciatica is a location in the body. It's a nerve. This nerve is coming from the lower back. Okay, so this is your back, this is the pelvic area, and this nerve is coming like this. So there are two things like this, they're coming. Okay, but in between, what they do, am I missing anything? No, I covered everything. Okay, so so this nerve, sciatica, they have like two coming down and going. Okay, so they gets reunited at certain level in the body, and that's where the L5, L4, L5, S1, S2. These are all, that's the point where that sciatic nerve is getting reunited. Okay, and then the second part, the first one is this one, and the second one is S3, and then the sacrum is S5, the last tailbone. Okay, so they are infused. So we are not worried about the S3, S4, S5. But lumbar one, which is our kati, which is our back, which is dominated by the vata dosha in the body. So lumbar area, the uterus area, the lower abdominal area, the lower back area, the pelvic area, the pelvic region, that's where you have tumors, fibroids, right? This is all dominated by the vata dosha in the body. Okay, so see the pathology, the way you have it is like the Ayurveda says that the causative factors, now we can't talk a lot because you have so many things to figure it out which causative factor is causing. But just simple things, two things you remember. There is a lot of inflammation in your body, which are modern science as per your other things. But Ayurvedically, if you want to say it, there is so much inflammation, there is so much pitta aggravation in your body, and there is so much aggravated vata in your body. So if we can manage these two things in your body through your diet, through your lifestyle, through your whatever the rituals you do. Again, we do rituals knowingly or unknowingly. Whether it is helping me or hurting me, we just don't know the logics behind it. We will do certain things and which will calm down the excessive pitta and which will calm down the excessive vata. Today, as you have so much tremendous pain and you took a painkiller to come here all the way from Winston-Salem, is that right? Yeah. Right? So what we will do, we'll just do a kind of small session, just massage kind of thing, and Svedana, which will help to open up. So to calm down the excessive aggravated vata in the body, in Ayurveda we have the therapies. It's called it as a abhyangam. Abhyanga. आपको भी बहुत बार किया है ना, ये तो बहुत बार आते हैं आयुर्वेद के लिए, है ना? So the abhyangam therapy, we will do it, and then we will do the Svedana therapy to open up the pores and toxins and detox a little bit. But through the diet, I will guide you certain things later on. But we will do some, whenever you are open to this, I will give it to you some kind of ways of doing some Ayurvedic herbs just to guide you to calm down your irritation, inflammation, that inflammation. Itis means inflammation. Okay. The Latin name for the inflammation is itis. That's the medical term. But it's a kind of an inflammation in the body, inflammatory things. So these are the things you need to understand, because this is like, आपको joint pain, stiffness, pain, sciatic pain, even if the sciatica is getting originated, that's the weak point because you have a sitting job, right? You say like your job is like this, right? So that's your one of the causative factor also. हेतु बोलते हैं उसको आयुर्वेद में. So the hetu has to be kind of managed or resolved. But now, how will you resolve that hetu concept, right? So, mindful way of sitting, mindful way of doing, supporting your back, supporting your lower buttock area, pelvic area, whatever you'll be doing, you have to be very mindful because the intensity of your pain is like tremendous.
Yeah.
Tremendous.
Yes.
And sciatica pain, it's not the shoulder pain, headache, migraine. That pains are very different. Sciatica pain is like you can't even breathe with that pain.
Yeah.
That kind of sensitivity is there in sciatica pain. है ना इसको आयुर्वेद में the name for this disease in Ayurveda is Gradhrasi. Gradhrasi. Gradhra means vulture. You will be walking like a vulture because the way you have a pain, you don't have a control. You don't see. So you will flap like you feel. Vulture चलता है ना kind of वैसे kind of चलेगा ऐसे. So that's how you will be walking like that. So forget about the vaccination, forget about the things, whatever happened until now. From today onward, just you can manage some of the diet, which can be anti-inflammatory. But we don't talk about inflammation. We talk about Vata, Pitta, Kapha in the body. So we'll stick to the concept of Pitta and Vata in your healing.
Sure.
Make sense?
Yeah.
समझ में आया? समझता है ना?
Yeah, yeah.
है ना? समझे इसलिए मैं बताती रहती हूँ ऐसे, है ना? ये जो पेन, स्टिफनेस, सेंसेशंस, बर्निंग सेंसेशंस, ये नर्व स्टिमुलेशन, ये क्या हो रहा है ना, ये कुछ तो इरिटेशन अगर ये मेंटल के ऊपर जाता है ना तो फिजिकल के ऊपर वो काइंड ऑफ नर्व के ऊपर वो इन्फ्लेमेशन जैसे आता है, इरिटेट करता है वो नर्व को, इरिटेशन होता है उसके अंदर बहुत अच्छी तरह से. तो वो आपको कहीं पे तो फूड के थ्रू भी काम करना पड़ेगा. कैसी स्टिमुलेंट नहीं खाने की चीज़ें, ऐसा कुछ नहीं खाने का इन बिटवीन जो आपको इरिटेट करे, है ना. आपके खाने के अंदर एग्स है, खाने के अंदर टोस्ट है, खाने के अंदर ये जो भी चीज़ें हैं ना, थोड़ा सा आपको वहाँ पे थोड़ा सा सात्विक जैसा खाना खाना पड़ेगा, है ना. एग्स और ये ना पित्त को बढ़ाते हैं, पित्त प्रोटीन बोलता है ना, प्रोटीन 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 होता है ना, इसलिए खाते हैं ना हम लोग, सोच सोच के खाते हैं कि ये मुझे कुछ प्रोटीन देगा, ये देगा, ऐसे नहीं होता है. योगर्ट भी, ये जो योगर्ट एंड ये एग्स, योगर्ट, स्पाइस, ये जो भी कुछ चीज़ें हम फूड के थ्रू लेते हैं, सलाद को तो छुओ ही मत आप, वो कम्प्लीटली आपका पित्त वात बढ़ाएगा और पित्त बढ़ाएगा, है ना. आपको तो याद होगा जो हमने सिखाया था सब, है ना. थोड़ा बहुत क्यों भाई साहब, पूरा तो बोलो. आपको बहुत सिखाए, 2-3 बार आप आए हो पंचकर्मा के लिए, ऐसी ना ये बात है ना. समझ में आ रहा है. चलो आज आपके ही बारे में बात करते हैं, इनको भूल जाते हैं, है ना. तो ये वाता और पित्त को अगर आपको, यू शुड नॉट डिस्टर्ब द वाता एंड पित्ता specifically with the salads and this kind of things. That's not really for the pain management in Ayurveda. In pain management in Ayurveda, you need to follow certain diet and certain food. Okay? All right.
So
Any
at
questions?
that time they, like what to stay away from and what to do.
Absolutely. वो पूरा एक लेक्चर लूंगी आपके ऊपर, है ना. I will make sure that I will guide you that. But today is a little bit tricky here and there with the timings. So I will just do maybe an hour or two, whatever आपका लेवल होगा पेन इंटेंसिटी का, मसाज करके आपको भेज दूंगी, मसाज टीम शिरोधारा करके भेज दूंगी.
So we have to come again for the
Yes, ma'am.
guidance. Yeah.
Yes, that I can do on phone.
phone पे कर
Yeah,
सकते
phone
हैं.
पे, yeah.
Okay,
Okay.
that'll be great.
All right.